Next speaker invited is Dr. Avdesh Oli. His topic is modified patch test to elicit Mizou phenomena.
Respected judges and dear colleagues, I will be presenting on a modified patch test to elicit Mizou-Nakamura phenomena. So, we all have heard Oguchi disease is an important differential diagnosis of night blindness, which characteristically presents with the Mizou phenomena, which was described by Japanese, and which is disappearance of yellow sheen of the fundus after dark adaptation. Means the fundus gives a different appearance when it is light adapted and different when it is dark adapted. So for this we require a dark room which is conventionally used to elicit the response. However, in a modern day ophthalmic clinic we have space constraints and it may not always be possible. So we describe a modified patch test to demonstrate Mizou phenomena. Also the metabolic, genetic and multimodal features of a case of night blindness are described, who was initially diagnosed as Oguchi disease based on this phenomena, but genetic testing finally clinched the correct diagnosis. So a young male presented with night blindness for past 10 years. He gave history of alcohol abuse and chronic liver disease. So he was initially diagnosed as a case of Oguchi disease. And at presentation his vision was 20/40 in both the eyes. He had dry eye and increased mucous debris. His color vision was normal, pupils were normal, and fundus showed yellowish sheen with flecks. And this is the OCT, which is showing these hyperreflective dots in the outer retina, and in the autofluorescence also we can see these hyperfluorescent specks in the peripapillary area. So to simulate a dark room and elicit Mizou phenomena, we patched this patient with conventional cataract surgery patches, and we could elicit this phenomena, as you can appreciate from the photographs, that before patching there is a yellowish sheen of the fundus, which is when it is light adapted, and after it is dark adapted, that yellowish sheen disappears. Similarly, in the other eye, before patching which is light adapted, and after patching it is dark adapted, and that yellowish sheen disappears. So we went ahead and did the electrophysiology studies. The ERG showed reduced rod function, EOG showed reduced Arden ratio, and we did his vitamin A levels. They were very, very low, less than 1000 times, and his liver function was grossly deranged. As he was earlier labeled as Oguchi disease, so we went ahead with genetic testing for SAG gene mutation. It was negative, and based on the clinical features, he was finally diagnosed as a case of alcoholic liver disease with severe vitamin A deficiency. Vitamin A supplementation improved his symptoms, and this modified patch test was useful to elicit Mizou phenomena. In this case, we found that vitamin A deficiency could be the cause of Mizou phenomena because he didn't have Oguchi disease on genetic testing, and OCT changes in vitamin A deficiency need to be carefully looked for as they are described in the literature. Hyperreflective dots in the outer retina, as evident in this case, might be due to photoreceptor accumulation due to reduced phagocytosis, and clinically they are localized in the outer retina. Genetic testing in this case, in such cases, might help to clinch the correct diagnosis. Further studies may be planned to correlate levels of vitamin A and natural course of this Mizou phenomena. And this is important because with increasing population at risk of vitamin A deficiency, not because only of malnutrition, but also because of statin use, bariatric surgery, the patch test might help in screening and early diagnosis of such cases. And this modified patch test might also be useful for cases of cone dystrophy and color blindness where dark adaptation is required. Thank you.
Any questions, sir?
So was this a case of adult vitamin A deficiency originally, or it is Oguchi's disease?
Sir, I think to begin with, maybe when the comprehensive history was not taken for alcohol consumption, that time the vitamin A deficiency could have been missed. Because on genetic testing there is no mutation for Oguchi disease. So to begin with, it was a case of vitamin A deficiency, and now definitely because the levels of vitamin A are extremely low, less than 1000 times. And we had another dilemma because the liver is not functioning, so we cannot give enough supplementation of vitamin A to him because it is metabolized through the liver. So in a decompensated liver, that was another dilemma.
So from management point of view, it will matter much?
Sir, from management point of view, because vitamin A deficiency is a modifiable factor, number one. Number two, we have to treat his systemic condition, maybe absolute abstinence from alcohol, and if it is very, very severe, then maybe a transplant or some other gastrointestinal intervention would help.
And for Oguchis?
For Oguchis, not much.
Nothing can.
Sir, nothing.
Okay.
Clinically, he didn't have any signs of vitamin A deficiency.
He had severe dry eyes, ma'am.
Dry eyes only.
Yeah, he had.
Thank you.
Thank you.